civiltà dell'amore. Fratelli e sorelle, costruite senza stancarvi mai questa civiltà. Lavorate per questo, pregate per questo, soffrite per questo.
Buonasera.
Good afternoon, all of you. Welcome to meeting. And well, we are here at the meeting, and for us it's always great to rely on this place. The fact that we know that this event is going to happen, and this year it's even richer than before. We here, well, with actually, well, our chairman, Mr. Camillo Rossi. He is connected with us. Is he connected? Well, this is actually something unplanned. Just a second. All right, here is Mr. Camillo Rossi. He couldn't be here today due to, well, some personal reasons. And actually also the Undersecretary Costa couldn't be here for some personal engagements. So as you can see, we are really in line with the title of this event, that is to say, a powerless health, powerless when facing new diseases. And so I'm going to leave the floor to my dear friend Camillo Rossi in order to introduce today's meeting. Thank you. Welcome all of you. It's a great honor for me to be the chairman of today's event. I will try to be very short, very brief, and I will also try to give some hints in order to allow our dear guests, Mr. Benigni, Pregliasco, and Dr. Panfilo, Ms. Panfilo. Well, I will just hold a very short introductory speech on this very crucial theme, which has really affected all of us. That is to say, especially in the last few months, with the massive use of antibiotic therapies, we have been observing that, during this pandemic, during this disaster, during this pandemic, we are wondering, are we going to have the right tools in order to face new problems, new diseases, new viruses in the future? In the last couple of years, there's been a massive use of drugs. And so we're now wondering, are we going to be able to to face the new diseases of the future? Antibiotics are frequently used, and all of us have been to our family doctor, and we have asked, for these drugs, maybe the latest generation antibiotics even. And as you can see, well, actually, some products are not available on the market anymore because they are considered, even if, they were considered as a sort of weapons in order to be protected against COVID. And as we could read from the press, there's no stock anymore of some of these drugs. In a few words, do we have the right weapons? Have we overused them? Have we used them in the most correct way? Is it a technical problem at the moment, or what is the current problem we're facing? In the last few years, as you said, Pasquale, you have been talking about unplanned events, for example, the fact that I couldn't be here with you today, couldn't be there with you today. You know, in February 2020, we had to face COVID, and now we're here talking about the availability of tools, of innovative drugs, which, if they are not used correctly, they become old too fast and they're not efficient. This is the first comment. And then also, as we have learned in the last few years, we don't live by ourselves. We live inside an ecosystem. And the international organizations, therefore, have defined the One Health approach to health, that is to say, continuous interaction between human beings, the environment, animals, etc. And this had a huge impact on us, of course. And then my third comment is that, of course, we are receiving a lot of input on tailor-made medicine. That is to say, I'm using the right drug for the right patient in order to solve the problem of that patient. So a very individual approach. And this is an approach that we've been using for cancer therapy for many years by now. But, well, you know, at the same time, we know that we are all part of the same ecosystem. And then another observation, another comment that I'd like to make is that you know, and here with us we have representatives from the industrial world. You know, there's been a lot of research being carried out in the last few years. So thanks to that, thanks of all this research work, all these research activities, we have managed to accumulate a lot of know-how, which then proved to be very useful when we had to design some sort of emergency weapons. And without that, without all of that research activities, we wouldn't have been able to do what we have been doing in the last few years during the pandemic. But we have to be aware of that. If we don't use in the right way all these weapons, all these tools, and well, you know, we have the representatives of the sector here with us, and you know, this is a world where multinational companies are working for people. And, well, of course, they also have profits. They have economic profit. But what they do is very useful for thousands and thousands, billions of people, actually. And so considering all these points, considering all these comments, now I'd like to conclude my very short introduction by saying that, well, the patients are not the ones that we were used to in the past anymore. I'm a doctor myself, and I have, I'm also a patient, of course, but I can't predict. I can't take for granted what kind of therapy I will prescribe to a patient without talking to that patient, without understanding exactly about that patient. Therefore, the current emergency is certainly a technical emergency, but at the same time, we also have to conceive the right communication. We also have to train people, educate people on how to use the tools in the most correct way. And, these tools are sort of weapons for us, but we have to use them in the most appropriate way. Thank you. This is all from me. Thank you.
Camillo, c'è un motto.
Camillo, there's a slogan that said that doctors also have to take care of themselves. And so, Camillo, please take care of yourself. And now, I have a question for all the speakers. First of all, for my friend Benigni. The question is, do we have the weapons and are they useful? And as Pregliasco said, he was the Director General of the Civili hospital in Brescia. Well, he said that a lot was learned between the first wave of COVID and the second wave of COVID. And he said, hopefully, we will not lose all the lessons we've learned, all the solutions we've learned and we've found. And therefore, we all remember very well what has been happening in the last few years. But my question is, do we have the weapons? Are they the correct weapons? And above all, how do you think we will face the challenges of the future? Well, first of all, thank you for the very kind invitation. Thanks to the organizers. Thank you for giving me the chance to share my comments with you. Well, I would like to start from the title of this roundtable, that is to say, Powerless Health. And I would also like to underline a few points that we often forget about. First of all, the founding principles of the Italian health system. We have Article 32, and we also have the law of 1978, 883. So universalism, equality. And so I think that these are great achievements for a country, as Minister Speranza said yesterday here on this very stage. These are social achievements for a country, and my generation, the people who are 40 years old now, we have the responsibility to defend these principles and also improve them for example, the topic of equality, equal treatment for everybody, and equal access to treatment for everybody. And the second aspect is resilience. The definition of resilience is a physical principle, and it is also applied in the field of psychology. And resilience refers to the ability to respond to emergencies, go back to normality, and being able to overcome a difficult time, a time of trouble. This is actually what we have gone through during the past 2.5 years. And then there's also something else that we often forget about. Italy ranks sixth in the world for the average life duration. It's 84 years in Italy. We only have Switzerland and Macau, and Japan actually is the only country similar to our country. It's 85 years. So, we have a very good quality of life in Italy, but also the National Health Service, for sure, contributes to achieving this great result. These are very positive aspects, in a way, are not in line with the health spending figures in Italy. Italy invests 6-7% of the GDP in health expenditure or spending, and instead 16-17% for pensions. Some other great European countries like Germany, France, Spain, they spend 12-13% for pensions. And this is their choice, but it's also a political choice. So it's a choice that probably we should also debate. And, especially now that we are in the middle of the election campaign in Italy. Despite this negative figure, something else that I'd like to remind you of is what the health operators of the public health system gave us, what they taught us during COVID. They really taught us what hope is, and also about the topics that are being debated here in Rimini. They showed us what passion for the person is. And it was a great example for us, since we're very lucky we work for private companies, but actually during those weeks, they helped their colleagues as much as they could. And an example, one of the main companies for companies providing infusion pumps during those weeks, together with face masks and many other medical devices. There was a huge request, a huge demand for those devices. And during those days, inside my organization, we tried to find as many infusion pumps as possible in my company, BD. And, we managed to find a lot of them. And this is thanks to our colleagues that were directly committed, directly working in the hospital departments. Again, if we don't want to be unprepared in the future, what should we do? There are a few things we can do in order to be prepared in the future. First of all, stability and clarity of rules. First of all, I'm referring to political stability. Like it or not, government stability, parliament stability is fundamental if we want to make sure that our plans, or even just the election plans or election programs, are really complied with in this country. Second, the second point refers to organization stability. It's very important to have stability in terms of health and hospital management. I think that people, also inside hospitals, health facilities, they need to have the chance to implement their corporate strategies and visions. Third point is the clarity of rules. And I think that Italy is probably the industrialized country with the highest number of regulations, rules, laws. And of course, we need to simplify this. We need to have a deep simplification process, especially also in the relationship between a private and public health system. Just some other practical examples. We have the famous payback law that was introduced. It was supposed to be introduced, actually, also for the sector of medical devices. It was passed in 2016, but today in 2022, it's not been implemented yet. And it's very difficult to me to explain to investors BD is an international American company. It's very difficult for us to explain to them how come the payback has not been implemented yet, because we don't have a decree. We don't have a decree explaining how it should work. And, we work in a sector that is highly regulated, and those who buy the products define the prices, and it's very messy. It's very complicated. But in general, the topic of the clarity of rules is fundamental. If I'm not wrong, there are some studies showing that this is the main reason why international investors keep far from Italy. They struggle a little bit to think about investing in Italy. Recent research says that the total cost for companies is more than 57 billion euros. If they wanted to find their way through all these rules. And this is why one of the most important reforms that has been requested is actually, simplification reform in general as part of the National Plan for Recovery and Resilience. And then last, the ability to introduce innovation, as Mr. Rossi said during his introductory speech. The partnership between private companies and public companies was very efficient during the pandemic. Something that we learned during that period is the need to reduce the time to market. That is to say, the time needed in order to market the new technologies, to sell the new technologies on the market. For sure, this will make the difference in the next few years. We already have some tools that must be implemented at a national level. Referring to technology assessment, referring to PPP, this is public-private partnership, and also value-based approach. We're now starting to see some examples in the most virtuous regions, but I can guarantee that there are some deeper gaps among the Italian regions. And then the last aspect that is one of the main enablers in order to be prepared for the future, well, it is the great opportunity offered by the National Plan for Recovery and Resilience. Thank you. Well, thank you so much.
Non so se avete notato.
Well, I don't know if you noticed that while Doctor was speaking, there was a word that he used and that explains whatever he said. It's dichotomy. Because we need to find a response to this dichotomy, otherwise we will be unarmed. Now, the floor is yours. Dr. Panfilo. Well, the topic is very challenging. And let's remember the title, Powerless Healthcare. We used all the weapons all together, and I think that our country was very successful in fighting COVID, but it was also a success of all research centers in the world that worked together. They collaborated in order to get to solutions, to the best solutions as soon as possible. But there's another point. And this is what we are talking about today, that is the antimicrobial resistance, not only against new diseases, but also against the ancient diseases, the old diseases, the diseases that we already know. I'm part of the working group of Farmindustria, and Farmindustria wanted to have 19 experts dealing with a multidisciplinary activity and provide recommendations. And these recommendations should be taken into account by institutions, by healthcare representatives, but also by citizens, by the general public. This is why this is the best moment to talk about it, because the World Health Organization launched the Global Action Plan against antimicrobial resistance in 2015. And so in 2025, 10 years will have gone by. This is a plan that involves all countries, rich countries, countries with low and medium income. And the purpose is to understand and underline that surveillance is very important. Because, antibiotics have meant incredible innovation and breakthrough after the Second World War to reduce the impact of infectious diseases. And I would like to show you the situation that we have been monitoring, and I hope that you can see on the screen a map, let's say, of the situation. It has been monitored by the WHO and ECDC that have collected data for every country. Look at Italy. The darker the color, the higher the risk of mortality for these strains that you see here. So, for Klebsiella pneumoniae, Staphylococcus aureus, and Acinetobacter, you can see what kind of situation we have. The risk is really to increase mortality. The WHO calculated that 4.5 million people in the world die due to infectious diseases that are resistant to the currently available antibiotics. And it has set the 4 strategic priorities to fight against resistance. And, well, this has to do with the politics and institutions. The main priorities are strengthening the leadership, guide, drive public health care in all countries to face resistance, promote R&D and fair access to vaccines and diagnosis, as well as new antibiotics in all countries. And another important thing is to monitor through data the quality and steer actions at a local level, national and global level, because you know there are important differences even within a country. Between the north and the south of Italy, there are important differences. And so the plan hasn't been applied in the same way in the different regions and hospitals. In our world, which is a digital world, the fact of monitoring data will allow us to drive actions both at a local level, so from, let's say, a micro level of hospitals, up to the national and supranational global level. Because, you know, this antimicrobial resistance is a concern both for Italy, but also for Europe and the whole world, because we could get up to 10 million deaths in a few years. Together, thanks to the collaboration among all disciplines, well, we will be able to find solutions. And in order to do this, 3 working groups have been created. The first one was on vaccines against resistance, and 14 recommendations have been drafted. Here are the recommendations for the relationship between vaccines and antimicrobial resistance, AMR. Considering figures, we realized that in 2020, the use of antibiotics was lower than in 2019. I was talking about this with a few colleagues, and we realized that, you know, in 2020, we had COVID, but we had no flu. And that's why antibiotics were not prescribed. But do you think that antibiotics should be prescribed when there is a flu? Not at all. However, when there is an important epidemic of flu, the use of antibiotics soars. The same example was given for COVID earlier on. So it is very important to, you know, focus on how to use correctly antibiotics, but also how to develop new antibiotics. As I'm a representative of Farmindustria, but I'm also the director of ASST. It is a company that has been carrying out research, because research is fundamental. But it is also very important to have the right reward, let's say, when the innovation of new antibiotics is recognized. And finally, the use of antibiotics and, let's say, inadequate use of antibiotics. So we should use antibiotics in the best way, not only because, for example, well, if I say that I have a flu and I want an antibiotic, a doctor should say you don't need antibiotics because a virus will not respond to the use of antibiotics. And people need to know that antibiotics should be used in the right way, even when there are rapid tests that allow to understand immediately, for example, in the intensive care unit, if it is necessary to use a new antibiotic because we are, let's say, in the presence of a superbug. And so hospitals should manage this situation correctly together with all the healthcare professionals, doctors and nurses. So use antibiotics in the right way, and finally inform people, citizens, the general public in the best way, because we are responsible as individuals, as families. And considering that there is a topic at the meeting, which is the passion for the person, I can say that we will be able to fight new diseases as we did with old diseases, because all together, working together, we can achieve our goal. Thank you.
Grazie alla dottoressa, anche perché
Thank you, Dr. Panfilo, because what you said allows me to introduce the next speech by Fabrizio Pregliasco, who is both the health director of the hospital and a representative of the virology section. So I would like to ask you, as an expert and as a normal person, what kind of weapons we have to deal with the situation. Thank you. It is a great honor to be here because I've been coming here for several years. I started in the past in a different way, but I have been coming for a long time. I think that what my colleagues said is something positive, that tells us something positive about the approach, which is very important. Because, you know, we have realized also with COVID that this kind of scientific communication and positive communication is crucial. Marina Panfilo has already underlined the importance of collaboration, of connections, which is also core for the meeting. As the colleagues have already said, there is both the responsibility of the individual for using correctly the antibiotic, because very often, you know, people decide to take antibiotics on their own, which is not the case, even though they could go for other kinds of over-the-counter drugs to deal with the flu, whereas an antibiotic should be used only after a checkup and should be used not massively, but only, you know, to deal with the situation in a different way. It is actually a very specific weapon that should be used in very specific moments and for very specific reasons. misuse is something that happens very often because let's not forget that an antibiotic is like a, cutting tool that reduces the destructive capacities of these bugs that were a problem in the past and they are becoming a problem once again. So if the antibiotic is needed, it is effective immediately and symptoms improve. But very often, people decide to stop taking the antibiotics and then their uncle or aunt needs some antibiotics, their opinion, and so they give the remaining drops or the remaining quantity to them. Whereas the use should be explained by specialists. I have been studying very often the situation of the flu, and very often people decide to take antibiotics to solve things. So whereas antibiotics should only be used in very specific moments, at very specific moments, in very specific cases, after a close monitoring of the person, as the COVID-19 pandemic has told us. Now, there are also, not only antibiotics, but also antivirals to fight against COVID. And I think that this is something crucial also for the future approach to COVID, the COVID that will remain with us, maybe with different intensity. But as I was saying earlier on, there should be an important responsibility in how we use antibiotics, depending on the kind of respiratory infections. For example, we should decide whether or not to use the antibiotics, taking into consideration the risks for the future. The other aspect that has been underlined by Camillo, this One Health approach requires the correct use and the right approach of institutions. In the past, antibiotics have been used massively by, those who wanted to maximize also the breeding of animals, the farming of animals. So antibiotics were used widely and often misused. In Italy, there are responsibility procedures also for vets, for them to use correctly antibiotics on animals, because, also animals need antibiotics to be used in the right way and in a responsible way. And then, moving on to other points that the colleagues have already mentioned, there is another kind of responsibility that is the pharmacovigilance, the knowledge of what kind of bugs are around, and we should fight both in hospitals where there are the most vulnerable people that are more exposed to risks and where overuses can determine things like Clostridium that give problems to already fragile people. And there's a colleague here who conducted research on the implementation of vigilance on some specific domains, because if we know who or what our enemy is, we can perform the best. Choosing antibiotics is crucial, even if it's sometimes difficult when we deal with patients. But again, vigilance is crucial, and in Italy it is not always carried out effectively and with responsibility. There is also this point of stewardship in the pharmacovigilance, also within hospitals, with different implications that have consequences also in terms of insurances, for example, because depending on the cases and depending on the different types, hospitals have always been troublesome in terms of possible infections through bacteria. But even today, we use invasive techniques that are more vulnerable patients. And so 3 to 5% of patients maybe can get infections that are not the cause for hospitalization. So this is where the stewardship responsibility comes from. And very often we encounter people, or there are cases of children that have been caught by these superbugs. And so this is just to tell you how complex the situation is and how important it is to strengthen this point. And also to take into consideration the choices that we made, because very often antibiotics are bought and represent an important share of the expenditure, but are misused. I'm in charge of the hospital Galeazzi, Sant'Ambrogio in Milan. And, we are very renowned for cardiology, but also in our hospitals, there are cases that we have to deal with, because very often it is unavoidable to have infections. But we made efforts to minimize these kinds of infections and try to be as effective as possible in dealing with this kind of problem. We know that this problem exists, but we should do whatever we can to minimize it. Again, the use of vaccines, if we think of the vaccine against the Streptococcus pneumonia, this is something very important, but also COVID vaccines or the flu vaccines, measles, because these kind of diseases can have complications, over-infections, and a massive use of antibiotics. Because even with COVID at the beginning, we thought that azithromycin had some anti-inflammatory effect, and there are a few colleagues that still believe it, but this led to a misuse. By the way, what I wanted to underline is that we need to have a passion for the person and a passion for the responsibility of everyone, a responsibility that starts from the knowledge and the responsibility of each one of us.
Per passare alla seconda domanda.
All right, so now I'd like to move to the second question. I would also like to highlight what has happened during the last 24 hours. Yesterday at 5 p.m. in another room, pediatricians talked about the collaboration between pediatricians who work in hospitals. And then here at 7 p.m., Dr. Rizzardini from Sacco Hospital talked about the collaboration between all doctors, nurses, and even administrative staff. So he really stressed out that during the pandemic, everybody collaborated. And I'd like to quote Bismarck, who said that doctor and patient are like on a desert island, and that relationship has to be preserved. The problem is that we're not on a desert island anymore. We are on a bunch of islands, and everybody needs doctors and nurses in order to take care of ill people. But this archipelago is a part of the system. And yesterday, Also, during another meeting, they talked about the fact that there are separated sectors and the barriers should be lifted. The problem is that the sectors need to talk to each other. So they have to collaborate. We have to go out of that contrast between sectors. At the end of Benigni's speech, you talked about PPP. This isn't just an example. I'd like to invite you also, well, showing respect to this place where we are now, because we are at the meeting. So please don't just provide us with the usual answers. Try and propose new types of collaboration because we need to have new solutions and we need talents to collaborate one with the other. So yes, there are endless opportunities for collaboration. I think this is well, all new ground for collaboration. For example, lab medicine. Well, if we talk about antibiotic resistance, there are many opportunities in order to establish new collaborations, which are not just about the tools. It would be great to collaborate in order to have new technologies, in order to have quick and efficient, reliable diagnosis, but also we would need to have the data available. And the data today represent the real asset which creates value. Nowadays, what we have to do is we have to build opportunities through the PPP, that is to say, public-private partnership, but also by reviewing the procurement processes in the health sector in order to create these new types of opportunities. And let me just mention another opportunity for improvement. Well, I'd like to explain what the current situation is in Italy in the procurement field. In Italy, we need around 350, 380 days in order to complete a bid, a tender or well, a public announcement for the health sector. In a contract. In other European countries, like in Germany and Spain, it takes between 200 and 250 days. What is very good is that in Italy, actually, well, during the urgency, we managed to reduce that time. So this means that we are able to introduce technologies, medical devices, drugs in a faster way. So this is the good news. We are able to do it if we want to do it. The bad news is that we still have a lot to do. So we have to rethink the processes in a very comprehensive way. Professor, well, I totally agree with you. You know, we need to lift the barriers. And, well, this is one of the slogans that we have to repeat day after day. And, you know, we have managed to join together different companies, pediatricians, family doctors, and experts in technology assessment, the IFA, the Upper Institute of Health, the Ministry of Health. And actually, they were very enthusiastic about working together. They saw that they can do better if they work together. Then with regard to responsibilities, this problem related to resistance to bacterial resistance. So we see that especially among the weakest people, so very young children and elderly people. Why that? Well, because they are the ones who refer to the hospital more often. They are the ones who have diseases more often. And so if we well, think that during COVID, actually, there was a reduction of vaccination in general. And this is quite absurd. It's a nonsense. We saw that COVID vaccine really helped people, but with regard to the other vaccines, there was a reduction of vaccine coverage. So we need to monitor vaccinations, and we have to involve all doctors. A great advantage we had during COVID is that all doctors were involved, not only those that deal with vaccinations, but also, those dealing with infectious diseases. They all have to collaborate. And since this is an issue that also has economic consequences, because, the fact that 1 billion euros was invested by everybody all together from multinational companies, also to support startup companies. With the Global Fund for AMR, this means that all research labs will need to work together. They need to collaborate because we've seen it. Science can be very successful in terms of public health and the great benefits that research can have. Research has a direct impact on the economy of a country. Even more so, that even the World Bank is dealing with it. So this means that research is a need we have, and we only have to put it in place. We don't have to sit down and relax. We do have the weapons, if we want to call them weapons. They are research, development, innovation, and the ability to take them to the patients. Because, the problem is that, in order to reimburse a drug for a superbug, you have to wait 1 year. And, this is the time you have to wait for payback procedures. I'd like to tell our colleague that we have known the payback for many years. And actually, we pay a lot. If the pharmaceutical expenditure is higher than the forecast, than the estimate. Professor? Well, it's quite obvious. It's quite obvious that it would be great to have all these things being implemented very quickly. COVID was the input from some points of view, and therefore there are some positive sides in the pandemic. Let me say that. There has been an overall organization that was not totally adequate. And we know that, our beautiful national health system does have some weaknesses, and it is like characterized by separate sectors, isolated sectors that don't collaborate one with the other. And so we have like the family doctor, we have the emergency department, we have the hospital, then we have many more services. They are very complex and they are very close to people. By the way, various Italian regions have decided to choose this approach in order to take care of chronic patients. This is a service that allows to provide continuity in terms of assistance by keeping very close to the patients. So again, we need to make the best use of our resources. And again, I'd also like to stress out that research is fundamental. But in the last few years, we haven't had many new molecules with new mechanisms, not many of them. There's been something interesting regarding some applications, regarding some new modalities, but actually most of action mechanisms of antibiotics that stop the reproduction of bacteria. So we block them and we destroy them. Most of these molecules have been observed already. And therefore, now what we need is we need to work like an orchestra. We need to work all together. And it's not easy. It's not easy. And we need a new approach. The so famous and frequently mentioned PNRR, the National Plan for Recovery and Resilience, will certainly support us. But I'd also like to highlight the need to consider the national health system as a fundamental pillar of our history. And as you know, together with England, we have this responsibility. We are the only ones having the state guaranteeing people's health. And so with regard to prevention medicine, prevention is seen as a basic element. We need to communicate, educate, and, during COVID, there's been this clear need for communication, but we also need collaboration between public, private, private facilities, hospitals, facilities that can contribute in a complementary way in order to provide services. And so this collaboration will certainly characterize the future. And this collaboration will have to be, what guarantees the quality for our health service in the future.
Abbiamo 3 minuti, per cui vi chiedo.
We only have 3 minutes left, so please, could you reply in 30 seconds? This title, Passion for the Person. You're all professionals in the health sector in a different way. So each one of you, how are you working? Sorry, let me find the words. How are you supporting the growth of your collaborators? Because, there's a lack of professionals, there's a lack of doctors, especially in some fields, specific fields. And we all put the blame on the university. I don't want to talk about that, about tomorrow, each one of you will go back to your workplace. How will you support your collaborators? 70-year-old collaborators, 35-year-old collaborators, regardless of their age, in 30 seconds. I'll be very short, very quick. I'm not going to list all the activities we're carrying out at the moment, but mainly we are worrying about the well-being of our collaborators. So make sure that when they come to work, they are well. They find themselves at ease. They feel at ease. This is what also the public sector should do. For those who work in the industry of drugs, in the pharmaceutical sector, we know that we have more responsibilities than in other industrial fields. And we do have responsibilities towards our employees. So we have to support prevention and also the health of our operators and our employees. So this is something that many companies are doing. They are trying to do it, and also about the use of antibiotics. We have carried out a lot of communication, a lot of education, internal education for our employees. Well, passion, stimulate passion and the willingness to do and to accomplish objectives. I have great passion in my life. I'm president of AMPAS. It's a very important health association, but volunteers are very important, as we see every year here meeting. And as I said already, it's very important to involve people so that they are willing to be active citizens, supporting important messages, simple messages, in order to provide responses, answers, but also to improve the quality of our life. Thank you. I'd like to thank you all, and also thanks Dr. Rossi, who's connected with us. I can say that this passion for the person means also passion for the meeting. You know, the meeting is a place, well, it's a privilege for us to be here. I'd like to invite all of you, when you go out, please, let's keep on collaborating with the meeting. Let's do whatever we can do in order to support it. Buy the lottery ticket, or if you go to those desks that you will find spread out here in order to donate something, some money, in order to support the meeting. And well, with this gratitude towards all of you and also towards the meeting, I'd like, well, to remind you that we will have more events related to the health sector in the next few days. Thank you.
Grazie.
Grazie a tutti.
Ciao Camillo.
Civiltà dell'amore, fratelli e sorelle, costruite senza stancarvi mai questa civiltà. Lavorate per questo, pregate per questo, soffrite per questo.